Welcome to this NITRUS Talk. Dr. Vasudev Makhija has given one talk earlier about mental health, and today he is here to talk about depression and give us some information about what it is, how to identify. And he has been working for a long time. He has founded an organization called SAMHIN, South Asian Mental Health Initiative Network, I think. And the website is probably, I'll share the website very soon. But without wasting any more of your time, I will invite Dr. Makhija to tell us about working on the topic.
Okay, thank you, Rahul. First, as we were talking, he asked me if I was a psychiatrist, and Rahul asked me. So I thought I'll clarify what a psychiatrist is, because people often get confused what a psychiatrist does, what psychologist does, and therapist does. So psychiatrist is first has to go to medical school, has to have an MD, and become a physician, and then specialize in the field of psychiatry. And then there can be further subspecialization, like we live in a world of subspecialization in every field, right? Even in psychiatry, there are subspecialization like child and adolescent psychiatry, forensic psychiatry, administrative psychiatry, and so on. A psychotherapist can be of a variety of discipline that helps people through talk therapy. They can be psychologists, they can be social workers, uh, and they can even have a PhD in education and be a therapist. Um, so some psychiatrists, traditionally psychiatrists also did psychotherapy, but in the modern era, smaller percentage of psychiatrists still do the psychotherapy, but they tend to focus more on medications with the wave of the rules and policies that occurred over the past 20, 25 years, where the insurance companies felt like they can get cheaper labor in terms of getting therapy from other disciplines than paying the psychiatrist. So they kind of shifted. And so over the past 20, 25 years, that has gradually gone that way. But some of them, fortunately, still uh, do psychotherapy, so that they can do both tasks, medications and therapy, which is valuable. So I've been asked to talk about depression today. Uh, so first of all, thank you. This is my second talk for you, and I think you had given a range of topics. And if people have suggestions for other topics in the future, you can share with Rahul, and then when the time comes, we can address some of those. So the topic today is on depression. The first of all, I mean, depression is such a commonly used word, and sometimes it gets confused with the normal experiences of sadness, which are also often described as depression. And but when it comes to a clinical arena, what we talk about depression is actually a disorder which is considered medical, a disease, and needs medical treatment, which includes psychotherapy also. So I mean, the normal sadness, which we all experience at different stages in our life, and we have lost someone or we've been hurt by somebody, separation, breakup, life circumstances, stress on the job, not able to deliver the project, or other things getting flung at us at work and families and socially, or sickness in the family. And these are normal sadnesses which we learn to cope with by different ways and become resilient, either with spirituality or different ways of strengthening ourselves to come out of that hole. So when it comes to the depression, which is uh, used in the clinical sense that I'm talking about, depression is something that an entity that will require intervention, medical intervention. So those can be acute episodic, which can last months, and then they get better. or they can run a chronic course. And when it's acute, when you treat it, it responds well to treatment, and then you come out of it. But if you don't, then it can linger on and become chronic also. And of course, as I mentioned, the third category is just the grief, which is the normal experience of sadness after you've suffered a loss of a loved one or some other major loss in our life. So the depression as a clinical entity uh, is manifested by certain signs and symptoms that are described by WHO and by the in the Diagnostic Manual of American Psychiatric Associations. And so these include, for example, feeling sad for no reason. Like, when somebody you find your friend or relative is sad, the people often say, why are you sad? You got everything. You got a great job. You have two beautiful kids. You have a beautiful wife. You have enough money in the bank. Why are you sad? And so that is an unexplainable sadness that they experience. They have everything, but they just feel sad, unhappy, and it's persistent day in and day out. Often it might be worse at certain times of the day than others. They lose interest in everything in life. They don't get pleasure like normally that you would enjoy, whether watching cricket, like some of you are doing today, or watching a favorite movie, or indulging in music, or socializing with friends. You lose everything. Some people lose appetite, they might lose weight. A few also have the reverse, where they'll eat excessively and gain weight. They have trouble with sleep. Typically, sleep difficulties might involve uh, waking up in the middle of the night or early in the morning, like 3 o'clock, 4 o'clock in the morning, and not being able to go back to sleep. That is more typical of severe depression. It's clinical depression, but it's not the rule. But that even though that is typical. Now, if somebody is just having that problem, getting up at 4 o'clock in the morning, not being able to go back to sleep, and has no other symptom, doesn't mean they have a severe depression. There could be other reasons for the such sleep difficulties. But along with others, this is the typical sleep pattern. People with depression slow down. They don't respond quickly. Their response will be slow. They move slow. They talk slow. They get fatigued. In our community, especially South Asians and some of the other Eastern communities also, East Asian communities, they tend to have more somatic symptoms, physical pain in the stomach and other areas, uh, because that is more acceptable to talk about physical problem than mental problem. A depressed person has a sense of worthlessness. They feel useless. They feel excessive guilt. They might talk about something minor infraction that they may have committed 20 years ago, and they will talk about as if it's like equivalent to a murder or something. They have difficulty with concentration. They're forgetful. They cannot focus. They have to read the same line twice, three times to be able to grasp what the line is saying. They have trouble making decisions. Uh, or they might have thoughts of dying or thoughts of actually suicide, or even end up making plans. And the worst of it is, of course, actually dying of suicide. And through these seminars and education, what we are trying to do is try to prevent that ultimate calamity. People with depression have significant subjective distress. But besides that, they also have difficulty with functioning in life. At work, at school, their grades are dropping. They're not able to keep up with their schoolwork, or at work, they cannot deliver the projects. At home, family is complaining that you're not doing anything. So that is the clinical depression, which warrants treatment. And we'll talk about what kinds of treatments down the road. So let me now shift and talk about the other aspect which I mentioned earlier about the grief. We all go through grief, and grief doesn't necessarily require professional engagement. They don't need to be referred to a psychiatrist, psychologist for treatment. How do you differentiate the two? I mean, the feeling of sadness is there in both, but in grief, the predominant feeling is the feeling of emptiness and loss. And they are often like, and it comes in waves. Like you might be okay 1 minute, and then suddenly you'll see a picture of the loved one that has passed, and then you just go into a deep sadness. And then you come out of it, what we call the pangs of grief. And these can be mixed with periods of joy at the same time. And while in severe depression, there is a persistent sadness. There is a there is preoccupation with the thoughts and memories of the loved one that they have lost. And in grief, the person's self-esteem is preserved. And in severe depression, as I mentioned, there is a lot of worthlessness, feelings of worthlessness, self-loathing, self-criticism. And if thoughts of dying are present in someone who's grieving, these thoughts are more related to the person that they've lost. For example, a fantasy or thoughts about joining that person rather than wanting to kill oneself. So, in fact, Summon recently launched a new support group for South Asians called the Grief Support Group. Maybe Rahul, you can share that link with the attendees so they will know and they can look at and read it later. So, if you know of someone that might be struggling, please share this with them and they can take advantage of it. It is free and they meet twice a month. Grief usually, the sadness that they experience, they usually it gets better in days, weeks, or months. In a small percentage of people, it tends to linger on for a longer period of time. And grief doesn't have a specified, timeline. Some people it does take a long time. Some people they recover more quickly, and it's not like one is more abnormal than others. But more recently, a couple of years ago, the American Psychiatric Association included a new diagnostic label called prolonged grief disorder to address the needs of a small group of people whose grief tends to linger on for past 1 year. And not only that, that they just still at that point they're stuck at a disbelief that they cannot accept and even believe that the person is gone, and they're not able to get their train back on track in life, not able to engage with family relationships, friends. So there is a controversy about this. Like some people say that, oh, here their American Psychiatric Association is pathologizing normal grief, and which is not the case, but it's an argument. So for that, also there is treatments now, which I'll talk about later. There is also screening available for people who have gone through that. You can just Google it, you'll get it. It's called PG-13, Prolonged Grief 13. Sometimes people use the word depression. Like you've heard the word, people use the word depression in variety of contexts. When the market goes down, they'll talk about market is depressed. So it's similarly with human experiences. Depression word is used when it refers to other things, other conditions that are not the clinical depression that we are talking about. Because if there's somebody who's very withdrawn, losing interest in things, losing pleasure and motivation and initiative, we associate these with depression, which is the common knowledge. But there are several other conditions that also have these symptoms, and their treatment needs are totally different. So that will have to be separated out by whoever is going to be doing the evaluation. But we tend to confuse the two. Another quick mention I want to make is uh, a bipolar depression. Have you ever heard the condition called bipolar disorder? It used to be called manic depressive illness in the past, and over the past few decades, they changed it to bipolar disorder. So bipolar disorder can be manic, where the person is high, euphoric, and they can also be depressed. But it is not as easily definable sometimes. So sometimes we treat patients, and the patients are not responding. So one of the questions should go through the treating doctor's mind: Am I dealing with bipolar here? Bipolar depression? And so the treatment strategies will be depression. So will be different. So that has to be thought of. So let me ask you a question. I don't know whether people can answer, but they can at least in their mind they can answer, and then keep it to yourself. Then I'll give you the answer. If someone you know is experiencing mental health crisis or is facing someone with suicide risk, having thoughts of suicide, what number would you advise them to call?
Yeah, so let me do this. Anybody who who wants to answer, just raise your hand, and I can then give you a chance. So, but this one, yeah, um, I guess would be 911,
Okay.
but that's
Others?
too extreme, I guess. And you can unmute if you want. Swati, go ahead.
Yeah, I don't remember the number, but there is a suicide prevention helpline. They help like talk people out of it. But if you see imminent danger, yeah, probably 911 would be the option, but I don't know the number.
Okay. So the new number for crisis lifeline, which is the national suicide and crisis lifeline, is called 988.
Oh,
988. And this was, they'd been working on it for a long time, and it was finally approved in July of 2022. And they're trying to connect with each state specific resources. So when you call the national line, the call is filtered through to the local level. Like in New Jersey, it's already established, and there are other states that it's established, but not all the states yet. But it's still, so it is 24/7, manned by trained counselors, and it can be available in different languages. So the difference between 988 and 911 is this, just quickly. 911, when you call, it's an emergency line. The police is automatically dispatched, even if you hang up the call. They can trace your call and send police to your place from where the call came. When you call 988, you're talking to a trained counselor, and who is trained to diffuse the situation most of the time by just talking. And a few times, occasionally, in a smaller percentage of cases, they have to refer it to 911. And that is only 2% of the cases generally, where they have to, if there is imminent danger to the self or others, then they will dispatch police and ambulance. So that is an important number to remember. Share with your friends who are not here today. So having talked about what depression is, let's move to talking about what are the treatments available now. So there is a broad range of treatment available for depression. One is psychotherapy, all kinds of medications. And then we are all coming from a culture, we are familiar with the holistic, naturalistic interventions. And there are other newer interventions. And there is the electroconvulsive therapy, what is crudely and conventionally called shock treatments. And there is TMS. I will explain all that as we go along. So the first one is the psychotherapy. What is psychotherapy? We call it also talk therapy. And there are many, many different kinds of therapies available. Okay, and Rahul will share a link with you. You can read at your leisure later on. This is on our website. This is the article we put together to educate people about what psychotherapy is. And if you know someone who speaks a different language, we have it available in like 3 or 4 languages. But this one is in English, so please read it and as to how it helps. It's psychotherapy is not the same as getting advice from your friend or your family. It goes beyond that. Psychotherapy doesn't just necessarily give advice. They help you find solution uh, based on your own strengths. There are different types of psychotherapies available, and one that there is a lot of evidence. One of them, there are several others, is called cognitive behavior therapy, CBT. It was developed by a professor from University of Pennsylvania. Aaron Beck was his name. He's the father of CBT. And then the department is still very active, run by his daughter. Um, Psychotherapy helps people, and there is also evidence enough from the research that it actually increases the number of neural connections in the brain, which in turn helps the mood. You know, so the depression, what causes depression? So one theory is that it is the dysregulation of certain monoamine system, which is like you've heard these terms like serotonin. Everybody has heard. In Florida, I was there a couple of years ago. There was a serotonin clinic there. I couldn't believe it in the mall, and it's like increase your serotonin to help you feel better, which they have taken it to an extreme. Of course, there's no evidence for that as far as I know, and so serotonin is just one of them. Norepinephrine is another one. So that is one. The other one is the neural connectivity impairment of different neurons, and that's where the medications and specific some kinds of medications and the therapy helps. So what are the types of medications? I'll give you just a quick overview. Um, in the past, we used to have medication, the older generation in the 60s and 70s, what we used to call tricyclic antidepressants. They were good antidepressants, but they had a lot of side effects. And also, the most importantly, if somebody took an overdose, there was a significant risk of death from the cardiac side effects from that. Um, are they banned? No, we still use them. When I was practicing, I still have few patients on that because they're very good, and in very difficult cases, they can be very useful. In the 90s, the newer drug, the Prozac, came out, which revolutionized the treatment, antidepressant medication treatment. So that was simpler to prescribe. You just prescribe a pill, no need to have complicated titration, starting from this dose, slowly increasing the dose. And so the primary cares physicians started prescribing. In fact, even now, I think 60 to 70% of antidepressant prescriptions in the country are written by primary care physicians, believe it or not. So the newer versions are the serotonergic drugs that enhance the serotonergic receptors, neurotransmitters in the brain. The other one is one that enhances two types of receptors, the serotonin and the norepinephrine. You don't have to remember those, just two different kinds of things. I'm just throwing at you. Some people may be interested. So sometimes we may have to use more than one medication if the person is not adequately responding to treatment. And that has to be used widely, monitoring the side effects and things like that. There is a special category of depression, and that is relevant to women um, for postpartum depression, which can be very serious and can cause, rarely serious consequences for the mother and the baby. You've read about that in the news, I'm sure. And we didn't have any specific medications for postpartum depression. We treated them with regular antidepressants that were available, but more recently we have had two different medications available. One is can be only given through intravenous infusion. So the person has to be in an institution, infusion over, I think, 60 hours or so. And the other one that came out more recently, a couple of years ago, can be given orally for 14 days only. And it seems to have a rapid onset of action to help the mother come out of the depression. So next intervention is ECT, or electroconvulsive therapy. It's also called shock treatment. It is one of the safest, contrary to what people have conjured up in your minds, that it's a cruel form of treatment. It's one of the safest and the most effective treatment. There is tons of research on this, and people who might have seen some of the old movies that show how the ECT is given are kind of, it's stuck in their head that it is cruel and primitive. The treatment today is very sophisticated. It is over in a minute, basically. They have an anesthesiologist available at hand, and so they don't have the kind of convulsions that they show that occur in the older movies. Again, One Flew Over Cuckoo's Nest. I don't know whether any of you have heard of it or seen. Um, Only downside is the temporary confusion and loss of memory, which lasts for hours or a day or so. And most people come out of it and do fine. More recently, there has been another treatment that has been approved, and it has been shown to be very effective, is transcranial magnetic stimulation. So it's like a sci-fi movie. If you go to the office of the doctor, you have this special chair with magnets sitting, which are pointed in a certain um, uh, direction on over your head, and it's supposed to help the depression, and it has doesn't have the same memory issues as the ECT. Of course, ECT is still a gold standard. It cannot beat the ECT, but this is also very good and is very helpful. The only downside with this is you have to go every day, 5 days a week, and you have to get about total 30 sessions, and that can be quite challenging for families to drive all the way every day. So now they have come up with more accelerated version of that treatment that can only be given in special institutions, not approved everywhere else. So just quickly, uh, uh, other treatments that are available for people who are not responding to the conventional treatments are, you've heard of ketamine? You might have read in the news. And ketamine is actually a general anesthetic that is given when people go for major surgeries. It is used, it is not approved, but it is used. There is research that it can help very severe depression that is not responding to conventional treatments. Again, this one has to be given intravenous infusion, very expensive. It has to be in a facility, and of course, it can increase your blood pressure, pulse, and also you can. There is a change in your mental status. You can become very sedated. Then they developed a modification of this called esketamine, which can be given through nasal spray. So which is easier. And this one is approved, but it can only be prescribed by certain physicians who are specially trained in use of this, because after you give the spray, the person has to be observed for a couple of hours in the office to make sure they're okay to leave, because it can cause significant sedation, sleepiness, and of course they cannot drive after this. It can be very helpful with severe refractory depression, especially depressions that are accompanied with severe suicidal ideation. And it can work rapidly, And as I said, serious side effects include this, and also it can depress the respiratory center of the brain. So it has to be done under close observation. And then finally, I mentioned about the holistic approaches, the yoga, the meditation, mindful meditation, breathing exercises that many of us practice. And of course, a conventional exercise, especially moderately severe exercise on a regular basis, at least 3 times a week, has been shown to help depression and anxiety. All these things, most of them have been shown to help mild to moderate degree of anxiety and depression. But generally, what I would recommend is you practice all these in conjunction with the conventional treatment, so it can enhance the treatment and the response. So I'm going to conclude this my talk. I'll tell you a little bit about Samhin. Oh, actually, before that, I wanted to mention a couple of more things. One is barriers to help seeking. You know, we had that listed in our list of things, topics to be covered. I almost forgot that. So there are some things that keep us from going for treatment, even when we are depressed. So one is the significant stigma associated with anything that is related to mental health treatment. We worry about what others think, or we have a certain mindset that oh, this will go away. You know, in many of the psychiatric symptoms are similar experientially to what we normally experience: sadness, nervousness. We normally experience these, and then we just think, oh, this is normal, this will just pass. Or we might be of a mindset that, oh, I should be strong enough to handle on my own. You know, I don't need this, you know, BS pills and you know, somebody helping me feel better, counseling, you know, I don't need that. And you know, seeking treatment is not a sign of weakness. I think it's a sign of strength. I think that it's like somebody, you know, having major physical, like somebody have a broken bone. I don't need, you know, some the orthopedist to do the treatment for me. I can handle it on my own. My bone will heal. I'm strong. So similarly here, we have to get out of that mindset and accept treatment. That is a barrier. And of course, the financial barriers in some people, or the insurance barriers, the insurance doesn't cover the care, and things like that. Fortunately, there are options available for those who cannot afford, who don't have a job, or cannot afford at all, or have no insurance. There are options available in institutions that they can go for treatment. And one last word about this, you might have read also, magic mushrooms. Anybody has heard of those?
Yeah, yeah.
Yeah. So there is no, these are not approved for treatment by FDA. And these contain a classic psychedelic, what we call psilocybin. And when you take it, they arouse this mystical experience of unreality, euphoria, everything looks different, colors look brighter, and you start seeing things in people that normally you wouldn't see. It has mild to moderate side effects, but it's not approved for depression. There is research, a lot of research actually going on the use of this in psychiatry. So I think with that, I'll conclude. A word about Summon. Summon is a non-profit. I think uh, you know, we offer a variety of programs. If you go on the website, you will see we offer a variety of support groups. We do outreach events, which includes talks like this. And we do in-person talks in the community. We do mental health screenings and things like that. So now I'll open up to questions.
Yeah, great. Thank you so much. I'm just pasting the site link. Okay, so thank you so much for this very valuable topic, which actually touches everyone. And you know, it's good to understand the difference between just sadness, nervousness versus depression. So what I will do now is I'll open up the queue for questions. I have received some questions in the form that I had submitted. Ask people to enter. I will ask those later. But first, if somebody has a question here, please raise your hand. There is a hand icon just below the screen. You press that, that puts you in the queue, and I can invite you one by one for asking your questions. And by the way, I have put all the 3 links in the chat session. One is that of the Samhin org, other is the grief support group, and the third one is the what is psychiatry. So, what is
Psychotherapy.
psychotherapy? It's a PDF. So going back to the list, I don't see any hands raised. I think Swati, you just unmuted. You want to talk?
Yeah, I tried to raise my hand, but for some reason it's not letting me.
Oh, okay.
Yeah. So, sorry, I joined few minutes late. Maybe it was already covered. I wanted to understand if somebody themselves or someone they know, how do you understand that it's depression? How do you identify that? Because I feel like we always find an excuse like, oh, I'm feeling like this because of that or because of that. Like, we don't try to get to the root cause actually. So, when it comes to depression, how do we know before we seek for help?
Yeah, I had that question also.
Mhm.
So you have asked a two-part question actually, Swati. One is
Mhm.
how do you identify depression? The other is what's the root cause of depression,
Mhm.
right? Those are the two separate questions. So how to identify is based on the reviewing what the experience of the individual is, the subjective experience, what the person is experiencing and describing. I feel this, I feel that, I feel very sad, I just don't enjoy anything in life. And the other part is what is observed by those around them, that the person is very withdrawn, he doesn't want to go out at all, he's become just there is no pleasure now, he has lost his smile, you will hear that. uh, you tell a joke, then they will have a forcible smirk, but they don't really enjoy it or laugh. uh, so these are the things that you observe, like normally the person, so there is a you have to look at the change from the baseline. If somebody who is always a loner, who always stuck to his own life, doesn't like to socialize, and that person you cannot confuse for depression. But somebody who is very outgoing, normally bubbly, and suddenly there's a change, so you look for what the change from the baseline is. Okay. And
Mhm.
then you review all the symptoms that I described earlier, the feeling of sadness, feeling of worthlessness, I'm no good, feeling like unnecessary or unrealistic guilt over some minor things, not being able to make decisions, having crying spells, or thinking of death or dying or suicide, uh, changes in appetite and weight, sleep difficulties, loss of pleasure, don't feel like doing anything. Everything is an effort. You know,
Mhm.
oh my God, how can I do this? It may be a small task, but to them, it's like a major task. So if you start seeing these, and these are persistent, and there is now, if this is not related to something that has happened in their life, some tragedy occurred and they feel that way, then it may not necessarily be a clinical depression that warrants treatment. It may get better with support that is provided by people around them. If there is grief, like even in our grief, for example, when somebody dies, all our rituals and the processes are developed to provide the support to the individual at the time of the funeral, then on the fourth day, and then the 11th or 12th day, and then again at 1 year anniversary. These are there, and it provides a lot of support to the person. It helps them come out of that.
Mhm.
So you don't necessarily need to refer them for treatment, but if there is no identifiable reason, then you have to start thinking, and they have all these symptoms that I described, then you have to think, is it depression, especially when they're persisting beyond like 2 weeks, you know and that sometimes something might have happened, they are not very outspoken person, and they'll just stay quiet and just be depressed or sad. But then after 2 weeks, if it's persistent, then we got to encourage them to talk and see what's going on. And you start thinking that maybe this needs attention, at least a good consultation, an evaluation, that the
Mhm.
professional they do the evaluation and determine if it warrants treatment or it doesn't warrant treatment.
Okay. Yeah. Thank you. Thank
Yeah,
you so
yeah,
much.
yeah. As far as your second part of the question, the root cause, that's a tough question to answer. There's no simplistic answer because that involves a lot more work, and
Mm-hmm.
depending on the person, the patient, I would call the person suffering from depression, and the treating clinician. So they have to collaborate and work at it, and in a interactive, a collaborative manner, uh, explore and come up with the answer to what that root cause is. We talked about the pharmacological, neurological root causes, right? But those are not really root causes, but the psychologically, like if there's a trauma involved in their life or something has happened, that has to be uncovered and then addressed in treatment.
Mm-hmm.
Thank you so much.
Thank you.
Yeah. Anybody else? Or I can go for the questions submitted on the form. Oh, somebody, Drillopedia LLC has raised question. I think it must be from my batch, I guess. Can you unmute and talk?
Yeah, Rahul, can you hear me?
Yeah, we can. What's your name? Is it Shrikant?
This is Shrikant Tiwari.
Oh,
Sorry. I
yeah, extreme. Always regular in our meetings. So, yeah, please go ahead.
had a question, Dr. Makhija. You said that some people might be mentally strong and they might think that they don't need any kind of treatment or something if they are going through some bad phase in the life. And you drew an analogy with the fracture. Uh, but so my question is that the fracture is a condition where there is a physical break, and probably you cannot do the self healing. But if someone is mentally strong and he matured enough and he can do the self counseling to overcome the depression, are you saying that that's still not advisable? They should still go for some professional help?
Okay. Uh, so it's not a matter of doing self-counseling. Uh, it is not that you are. So your question would imply only weak people get depression. Depression can affect anybody. You may be the strongest person, somebody who has a successful career, very strong mentally, physically, and you can have suffer severe depression. So that question, in a sense, uh, kind of erroneously implies that it is the illness of the weak people. And this is one of our misconceptions, especially in our community, and also in Western, and especially in the older generation American people, that if you're strong enough, you won't have this. So you're not only
No.
suffering from a condition which is now considered a medical disorder, then you're also being told by people that, you know, you're not even strong, you're so weak that you're suffering depression. So they're not only suffering from depression, then they are getting judged for suffering depression as if they caused it. So they have a double whammy actually. So you cannot counsel yourself. You can be self-reflective and try to help yourself, and which is a good thing. But if you have a serious depression, as I said, in therapy, it's a collaborative effort. So it's not that you're passively sitting there and somebody's helping you. You are part of the treatment. You are still contributing to it.
Yeah, I think that's great. And part of that, I think what got it from his question is, what's the threshold when you stop doing the self help and it's not working? Because sometimes you Google it. Okay, I'm feeling this. There is something. Okay, do this, do meditation, do exercise, do that, and then at some point in time you realize that no, it's not working. I need more help. So what's that threshold? Is that what Shrikant asked?
Well, yeah. The other part I was referring to, like I said, that in kind of a fracture there is a physical break. So, are you saying that when person has got depression, there is some kind of a temporary or permanent effect on the mind that cannot be overcome with the self healing, or is that something that can be done with self healing?
If it's a severe depression, self-healing can contribute to finding the solution with the help of the treating therapist, psychiatrist, but in of itself, it is not enough. It is an important element in it, but it is not enough in that situation
Okay.
when it's a severe depression, because it, otherwise you would be just suffering and lingering on.
Yeah.
Okay.
Have you
All
have
right.
you let me ask you, if you have you had experience with that? Somebody had severe depression and they were able to talk themselves out of it?
Uh, well, okay. I mean, what I would say is that everyone goes through such situations in life. I don't know how to quantify the degree, whether it's severe or just beginning, but what my feeling is that some people I have seen who are kind of in a situation that can lead to the severe depression, but if they are matured enough and are mentally strong, probably they can do some self-counseling so that it doesn't get to that level.
Yeah,
So
I think
that is what oh, are you done? Sorry.
no.
Yeah.
So that is again, I want to go back to that. That's kind of a flawed thinking, because again, that implies that depression is only illness of people who are weak mentally, which is not accurate. You can be a psychiatrist, you can be a physician, you can be a brilliant IIT engineer who has, I mean, going through IIT is a grueling experience. You know, it's not an experience for weakling. You know, you have to be resilient, how much pressure there is. And so these are people strong, but they can also suffer from depression. There have been suicides.
Yeah.
So that doesn't mean these people were weak, but they were unfortunately tripled with this severe depression.
Yeah. I think
I answered your question, Shrikant.
Yeah, you did. Yeah,
yeah,
definitely. Thank you.
sometimes what happens is because the stigma attached to it, people try to see if I can solve it myself, and then if then that goes undiagnosed, and then maybe that may lead to some sad circumstances. So I going to the questions asked on the form. Interestingly, these two questions are very much in terms of opposite of timeline. So one is about future, and other is about the past. So first question is, if somebody has hopelessness due to the fear of future, for example, will I have money in the old age? Will I have decent health? Like, we see old people, like our old relatives, they need a lot of help. Some get dementia and all those things. So, so that those are the things. So are those like normal, or are those depression?
No, that is not depression. That is normal. I mean, we all experience that. We all have those concerns. Will I have enough money when I retire? Will my health be okay? My uncle suffered from dementia. Will I be also getting that? I mean, those are realistic concerns.
Okay.
That's not depression itself. No.
Okay. But maybe if it leads somebody to lose interest in doing things, just withdrawn, I think that may probably be a symptom. If somebody was already always good, but then suddenly say, "Oh, I'm not," ultimately, what's going to happen? Everybody's going to die. So why do anything? That kind
Yeah. So as I said before, if you have, one or two of the symptoms that I described earlier, um, uh, it doesn't mean that you have depression that needs treatment. But if you have a whole range of symptoms, feeling sad, feeling losing interest in everything, very pessimistic, no motivation, changes in your weight, sleep, and all those symptoms that I described earlier. If you have a whole bunch of those symptoms, then and they are persistent beyond, even if there is a situation that triggered it, not all depression occurs spontaneously. It can be triggered by real life events. Doesn't mean that it is the illness and the depression is not real.
Yeah. The next question is about the past. So somebody says, how to deal with nostalgia? So they explained that our life with when the kids were young was very beautiful. We had tension, uh, but it was a very happy and laughing house. Now their kids are gone. We miss them, and we miss good old days, and we know that they are not going to come back again. So they are feeling sad about it, and so again, I guess that also can be said sadness rather than depression.
Okay, that's grief, right? So when we lose something, we grieve it. So when a child is growing up, right? First they get a tricycle, right? Then they lose that, but they're happy they're getting a bicycle now. And then after the bicycle, their favorite bicycle, they'll grieve if it's lost or not used. Then they graduate onto their first car, and it's so on and so forth. We grieve each stage in our life. It is not just losing someone to death, but also in our stage we grieve. We miss our the good old days. In time, we forget the bad aspects of our life, and we tend to remember the good part. And when you were back then, the kids were young. There was a lot of pressure. You had a demand of the job, and you were engaged in parenting for which you had no training. It was on the job training. You didn't know what the hell to do, you
Yeah.
know and you make mistakes, and you needed help sometimes, and you couldn't get help. There was a lot of pressure. So, but we forget that, thankfully. Otherwise, we'll continue to feel that pressure. In terms of the nostalgia, I mean, people have different ways of reliving nostalgia. People like reading, and now these karaoke clubs have become so popular. Every neighborhood has a karaoke club now. At least in New Jersey, they do. I don't know about other in California and Tampa. So people go and sing old songs and enjoy the nostalgia. They relive the past. And then WhatsApp groups have come up, the high school WhatsApp groups, the college WhatsApp groups, the engineering WhatsApp groups, so, and then they relive. Oh, you remember this professor that.
Mm.
I hope I answered your question.
Yeah, no, definitely you did. And I think that's all we have. Anybody else like Swati, Tamali, if you have any questions? If not, we can wrap up. We are almost at the end of the talk. So I think that's great.
Well,
Swati,
one last thing I would say is
yeah,
worldwide, I think depression is the second leading cause of disability
oh,
in terms of not being able to function,
mm,
college, work, family.
yeah, I think that makes sense.
Yeah.
Especially the one thing that you mentioned, that not feeling like doing anything, every chore becomes a very difficult task.
Yeah, it's become the chore, I mean, just making a normal breakfast can be like, take endless amount of energy,
And it had a snowball effect also. If you don't do something, then things keep piling up. Then you become more depressed. And then
Oh yeah, definitely. Yeah, absolutely it does. And then they feel guilty. Oh, I'm not even doing this. Oh, I'm
yeah,
not caring for my kids like I normally do. Then they start feeling guilt, and the more guilt, then more depressed. You're absolutely right about the snowballing effect.
yeah. I think the action probably is part of the cure, not 100%, but when you do activities like exercise or doing something, or if clothes are piling up, you just put them in the laundry. I mean, that's done. So those kind of small activities probably may contribute. They won't cure, but they may contribute to the. Thank you
Yeah,
so much, Doctor.
yeah.
This was a great
You,
session.
Yeah. One more thing, in terms, I covered the naturalistic things. I didn't mention spirituality. That also plays a significant role in our lives. That helps us navigate our paths of struggles and challenges in life,
Yeah.
and it kind of makes us feel grounded.
Mm.
So we all need that too. That's another thing that can be added to that list. So
Yeah.
thank you for having me. I appreciate it, and good questions. And I'm going to include this in my next talk, especially the talk about self-healing. It's a very good question. I'm glad you asked, because you're speaking for a lot of people.
Yeah. That's true.
Yeah,
Great.
thank
Thank you
you.
so much. So with that, I'm going to stop recording, and then we will. Okay, recording is stopped.